Hi, Dr. Rodriguez here again, Rodriguez Rejuvenation. What I'd like to talk to you about today is liposuction correction or revision. One of the things that I find most enjoyable and one of the things I'm very, very good at. Most people don't know this. Over half the people that have liposuction aren't totally happy with the results. They're happier that they look better than they did before, but they may have some areas where they wish, well, the doctor didn't take off as much here as I thought he would, or this is a little bit uneven, or the good news is that 90% of those patients we can improve. So today we're going to be doing one of the options for liposuction correction or revision, which is a non-surgical option. It's a procedure that I helped introduce to the United States called mesotherapy. I was fortunate enough to be featured on 2020 with Barbara Walters way back when, before she retired. And you can also go to our website to see that interview as well. But the way that particular treatment works is I'm actually going to be putting medications into fat cells. This is the skin here, and then these little yellow things are the fat cells. I'm going to be putting medications into the fat cells that damage the walls or the cell membrane of the fat cells. This makes the fat gradually leak out of the fat cells over a period of several weeks. The end result is that the fat cells get progressively smaller, they shrink down. One of my patients described it as, oh, we're going to take these plump, juicy grapes and turn them into shriveled up raisins. The grapes take up more space, the raisins take up less space. So this is a non-surgical option to reduce small fat pockets in people that had previous lipo, to improve the areas, or even in people that perhaps don't even want lipo, but this is a good non-surgical option. It takes time, but if you're patient, you'll be able to get some good results from it. In our particular patient today, she's a great candidate. She's in great shape. She works out. She takes good care of her body. You see she has a beautiful figure. And she's had liposuction here more than once to try to reduce the fat that's underneath the skin. She's got some uneven areas here where the fat's a little bit fuller after the previous procedure she's had. She's got some areas here also a little bit fuller. And if you just bend over just a little bit, she's got a little bulge here in this area that's fuller than she wants it to be. So we're going to be putting medications into these little different areas to destroy the fat cells there, to get those areas to shrink down gradually over the next 8 weeks. So here we're getting ready to inject the areas that I had marked. These are the areas a little bit fuller than our patient wants them to be after her previous liposuction procedures. What I do is a technique that I learned in France, where you kind of pinch the skin like this so that the patient is feeling the pressure and the vibration of my fingers, and she won't feel any pain from the needle. So we're going to get started here a little bit. I just squeeze like that and inject a small amount of medicine into the fat pockets that we're working to reduce. How's that feeling?
Doesn't hurt.
Doesn't hurt?
Doesn't hurt at all.
That's magic. But as you can see, I'm just injecting tiny amounts of medications into the fatty tissue here. I have to do a lot of injections, just tiny amounts, because there's some scar tissue underneath this area from the previous procedures. So I want to try to distribute the medications as best as I can to get as much of those fat cells that are kind of stuck and trapped in the scar tissue from previous operations. So we injected all the areas here that were bulging. They all have medication. So once again, this is a non-surgical way to reduce small fat pockets that may be a little bit uneven after you've had previous liposuction.